Hello, welcome to your online lecture for the course Anatomy and Physiology. In today's lecture, which is your final lecture for ANP1, we're covering sense organs. The body has millions of sense organs that contain sensory receptors, and a lot of today's lecture will be covering these receptors. The sensory receptors are going to be involved in detecting changes within our internal but also our external environment. We're going to have a look at how sensory information is transmitted to the brain and how the sense receptors are actually classified, because there's numerous different ways that you can classify them based on the structure that makes up their nerve ending, based on location, the type of stimuli, that sort of thing. On this slide, we'll introduce really the sensory receptors, but first of all, as you can see from this image on the right, you can see that in what is such a seemingly simple process of sitting outside reading a book, you can see how many different systems are involved. We have our autonomic nervous system, our skeletal system, our brain, and our eyes, and our eyes also taking in the light around us, especially from being outdoors. But it's even more complex than just this. So many different sensory receptors picking up information from our internal and our external environment. Many sensory receptors that receive information from our environment are going to be working together and making changes based on the information that comes in all, working to keep our body at equilibrium or at homeostasis. And so it's the sensory receptors that make it possible for us to actually respond to stimuli that are caused by changes in our environment. Sensory information is acquired through the depolarization of sensory nerve endings, and this concept was introduced in the nervous system earlier on. Sensory capability differs with age. It's going to, if you think about a newborn baby, their sensory capabilities are going to be very different than a child or an adult. It's also going to differ based on the presence of certain diseases, structural defects, or lack of maturation. But as sensory receptors become more mature, they become more acute and more capable. As we get older, structural changes in receptors are going to occur, or aging of these receptors. And what this can lead to, for example, is an individual that could once hear properly and their sense of hearing was strong and intact. As they get older, they may need a hearing aid. So really a reduction in sensory capabilities compared to what they once were. Our sensory receptors, speaking generally, are going to respond to a stimulus by converting it to a nerve impulse. So for example, if you touch something that feels rough, this sensation will travel to your central nervous system where processing occurs, allowing you to identify the object as being just that, rough. And you can thank very special receptors found in your skin for a sensation such as that. There are different types of receptors that will respond to different stimuli, and each receptor will be specific to one type of stimuli, and that's important. So for example, we have certain receptors that identify temperature. So if you touch something hot, then you have these temperature detecting receptors that we'll learn about shortly, specific for that hot sensation. Or for instance, if you're touching a smooth surface, there are different receptors picking up different information. Remember that sensory information is going to be brought to a processing center. And within the processing center, this is where information is going to be organized, and then a response will then be sent out. Okay, let's talk briefly about receptor potential. A stimuli is going to be acting on a receptor, and it's going to be converted to a potential, develop a potential, so a difference in membrane potential. And if the response is large enough, threshold will be reached, and an action potential or an impulse will be triggered, as you've learned about. Impulses will travel across an axon, making their way to the central nervous system. And then the sensation can be felt. So for example, you realize that the surface feels rough or smooth, or a reflex action can occur. Or a reflex response. So if you touch something hot, then you will pull your hand away in a reflexive action very quickly. And this, as we know, is a skeletal muscle response. Now we'll talk about the principle of adaptation, which is really a functional characteristic of sensory receptors. And the definition is receptor potential decreases over time in response to a continuous stimuli, which leads to a decreased rate of impulse conduction and a decreased intensity of sensation. So what does all that mean? Well, let's give you an example. If somebody wears earrings every day, they get used to it. In fact, not long after you put the earrings on, you've already gotten used to it. You've adapted because of rapidly adapting receptors. So if someone was to ask you if you were wearing your earrings, you actually might need to check because of how quickly your receptors have adapted to the presence of those earrings. Even with clothing on your body or a hat on your head, there's rapidly adapting receptors that are present. An example of a slow adapting receptor would include maybe wearing your backpack. Now, that would hopefully help you understand the function, which is that decreased rate of impulse conduction will lead to a decreased intensity of sensation. And so this happens when you've got earrings in, because your receptors have adapted, there's this reduced rate of impulse conduction, and so you experience a reduction in intensity of that sensation. If you're looking at this graph on the right, we can see here that joint capsule receptors, muscle spindles, are considered slow adapting receptors, whereas the root hair plexus, as well as the lamellar Pacini corpuscles, so in your skin, these are considered rapid adapting receptors. As long as there is a stimulus present, it will continue to send impulses to your brain. We can classify sensory receptors based on what they are used for. So we can look at it from a special sense and a general sense perspective. When it comes to special senses, which we're using really for receiving information about things such as smell, taste, vision, hearing, and equilibrium, these receptors would be found then in your nose, in your mouth, in your eyes, in your ears, etc. But they're found really grouped to localized areas. Areas are found within complex organs, so more localized usually. Whereas general sense organs, rather than special, are found more widely distributed throughout the body. They're going to give you information about things such as touch, temperature, position, your location, vibration. They'll be found in the skin, mucosa, connective tissue, muscles, tendons, joints, and viscera. We can also classify receptors based on their structure or anatomically, meaning we can actually have a look at what's actually happening at the nerve endings themselves. And you can see on the screen we have free nerve endings as well as encapsulated nerve endings. So these are our different classifications of receptors according to structure. Free nerve endings are the simplest. They're also the most common, and they're the most widely distributed of the sensory receptors. And they're located on the surface of the body, and so they take on the name exteroreceptors. They're found also deep within visceral organs, and so they'll get the name visceroreceptors. And we also have nociceptors that are involved in your ability to feel pain. We have thermoreceptors as well, involved in temperature sensations, as well as touch receptors. So for example, the root hair plexuses and Merkel discs. Now, free nerve endings often terminate in these small swellings that are called dendritic bulbs. And we have a few examples to look at the bottom here. On the top left, this is an example of the pain receptors or the nociceptors. And they're, as already mentioned, they're involved in you perceiving pain. The bottom left here, we have Merkel discs, which allow for discriminative touch, which is really a fine or localized touch. And then we have root hair plexus, and the root hair plexus gives you a sense of deflection type of hair movement. Encapsulated nerve endings, so moving on to the second method of classification by structure, are encapsulated, as the name suggests, rather than free. And they're encapsulated with a type of connective tissue capsule that surrounds the end, which is more evident in these two top images here. And they're going to include your touch and your pressure receptors. Looking at the image here, the top two are corpuscles, and the bottom one on the left here is a muscle spindle, and then this is a Golgi tendon receptors. So these two collectively here are referred to as stretch receptors. Muscle spindles sense muscle length, and Golgi tendon receptors are going to sense muscle tension. But both of these contribute to what we'll speak about on an upcoming slide. They contribute to proprioception, and proprioception is defined as the sense of knowing your body's relative position in space. Sometimes it's referred to as our sixth sense. So we have these proprioceptors that are found in our body that give us this ability to experience proprioception. You can think of it as allowing us to move and navigate in our environment, sort of inherently knowing where your limbs are, where your center of gravity is at any given moment. We can also classify receptors according to location. We have exteroceptors, visceroceptors, and proprioceptors. The exteroreceptors are found on or near the body surface, and they're involved in pressure, touch, pain, temperature, environment, and so the type of information they're receiving is all of that from our external environment. Visceroceptors, also known as interoceptors, so we have the intero versus extero. The visceroreceptors are found internally then, usually within body organs, and they'll monitor, as you would have guessed, information about our internal environment. So for example, these receptors could monitor changes in pressure within blood vessels, the stretch within our stomach or our heart, for example. They could measure changes in chemicals or the pH as well. They also are involved in monitoring hunger and thirst. And proprioceptors. This is a special type of visceroceptor, and it's limited to skeletal muscles, tendons, and joint capsules. And it gives you, as already mentioned on the previous slide, this sense of body movement and orientation. And remember, it's the muscle spindles and the Golgi tendon organs that are involved here. We have two main types, tonic and phasic. Tonic proprioceptors, both of them are involved in positional information because they're proprioceptors, but tonic is going to give you information while you're at rest, and they're slow adapting, whereas phasic is going to be during movement, and they're more rapidly adapting because you're moving, so they need to be. Here we have an example of the exteroreceptors. Sometimes you'll see it written as exteroceptors or exteroreceptors. They're found on or near the body surface, remember. And then proprioceptors are in joints, muscles, and tendons. So this is showing you an example of the muscle spindle and the Golgi tendon organ. We can also classify receptors based on the type of stimuli that can actually activate the receptor. So we have mechanoreceptors, chemoreceptors, thermo, nocio, photo, and osmo. Mechanoreceptors are activated by mechanical stimuli. So for example, in hollow organs, in order to determine fullness. they can detect stretch, they can detect pressure as well. So mechanical stimuli. Chemoreceptors are activated by the amount of changing concentration of certain chemicals. So it can monitor glucose, carbon dioxide, measure the pH as well as sodium chemicals. Thermoreceptors, referring to monitoring of temperature, and as I mentioned earlier, they're either going to be cold or heat receptors. It's not one receptor that is detecting both cold and heat. They are separate receptors that are collectively classified as thermoreceptors. Nociceptors are going to be activated by an intense stimuli, so it could be extreme stretch, extreme temperature, for example, that result in a pain sensation. There are medications that exist that can actually work to block the nociceptors, or at least that nociceptive feedback to the brain. Photoreceptors, these are found only in the eye and they're activated by light only. And finally, osmoreceptors, they can be found in the hypothalamus, for example, and they're activated usually when there's not enough water in our body. And so what it'll do is activate the thirst sensation so that you'll feel thirsty, you'll go and have something to drink to restore homeostasis. Recall that I mentioned that cold receptor fibers are going to be distinct from the warm receptors when we're talking about thermoreceptors. Both types of thermoreceptors, though, undergo rapid adaptation. We can adapt quite quickly to a cool or a hot shower in a relatively short period of time. Cold receptors, as you can see from this image, have a broader temperature response than do warm receptors. This next statement is obvious, but when it comes to heat, beyond a certain temperature, a sensation of burning will begin. When it comes to cold, you'll end up eventually with a sensation of freezing pain. The next part talks about discriminative touch. There are different areas, for example, in your foot that allow for you to discriminate the area of your foot that's being touched. So if you were to close your eyes and someone was to touch certain areas of your foot, for example, the heel, you should be able to determine that this was your heel being touched. And this is referred to as discriminative touch, or really a localized fine touch to a particular area. And this has clinical relevance and can be assessed as part of a neurologic examination, where you can ask a person just by applying a touch to a particular area of their foot where they need to tell you where they feel it, and you can see how accurate they are. And it's important that people still possess this feature. And even just a light stroke of the skin should be able to be detected by the individual fairly accurately. This slide talks about the importance of cutaneous sensation, cutaneous referring to the skin. In this image here, you can see what's referred to as a monofilament that's being used to check for sensation at the bottom of the foot. Individuals that have uncontrolled or poorly controlled diabetes, for example, often lose their ability to sense pain on certain areas of the body's surface, in particular the skin of the feet and even more so the toes. And so it's important to monitor cutaneous sensation in these individuals, because if they lose their sensation, what can happen is they can have a wire in this case, or let's say they step on a tack, they could walk around with this tack in their foot for quite a long period of time before somebody else notices that it's there. And at that point, it could have already led to infection. And once there's infection tissue, depending on the extent of it, the tissue doesn't usually heal well in diabetics, and it can lead to infection and tissue that dies within the area and could even lead to amputation. So monitoring this is important, because diabetics can develop what's called diabetic neuropathy, which is nerve damage, in particular to their feet. And the final slide talks about referred pain. And this occurs because When there's stimulation of pain receptors in deep structures, it can actually be felt as pain in the skin that either overlies that organ or even a surface that's far from that site. And so a good example of this would be a heart attack, in particular in men, where they can present with, even though their heart is actually undergoing what's called ischemia or lack of oxygen to part of the heart, they can feel it over the skin of their chest. They can feel it, within the heart itself, but they can also feel it in their left arm and in their left shoulder. And the reason for that is because the brain gets confused with the information because there's this convergence or mixing of sensory nerve impulses that come from the diseased organ and the skin that's in that area. So they think of them as, you can have these sensory signals traveling to the brain that follow along this common pathway, and the brain gets confused as to where the pain is coming from. And this is important clinically because if you understand referred pain, it can give you an idea of, based on much more information than just this, but it might give you an idea of what might be going on with that individual. So if you had a male present with that was out of shape and maybe a chronic smoker, a sedentary individual, and they come in and they have a variety of different signs and symptoms, including pain in their left arm, left shoulder, and left arm, then you should think, okay, we need to check to make sure this person isn't having a heart attack. Another example is the gallbladder. The gallbladder, which you'll learn about in the digestive system next term, is located on the right side of your body and in the upper abdomen. And when somebody has gallbladder pain, sometimes it can present as right shoulder or upper right part of your back, so near the shoulder blade region. People can present with pain in that area. And so it's important, again, to understand the common referred pain that comes from certain organ diseases in order to correctly diagnose someone, and as quick as possible. So that is not only the end of today's lecture, but the very end of your Anatomy and Physiology 1 course. Congratulations on making it this far. Bye for now.